Lovely greetings from Dr. Ramy Cardio Club. Today I would like to present for you a very challenging case that you will have in your exams or in your clinical practice on the ground. Let's start together. We have here Mr. A. He is 50 years old with history of diabetes, hypertension, chronic coronary syndrome. He has been admitted to the ER due to heart racing sensation and shortness of breath. His ECG showed atrial fibrillation with rapid ventricular response. His heart rate was like 130 beats per minute. Amiodarone has been started immediately to control his arrhythmia because he presented early. 6 months later, his doctor noticed non-pitting lower limb edema, excessive sleepiness, fatigue, unpredictable weight gain. On doing full laboratory investigations, his TSH is 12 and the normal range is from 0.5 to 5. ECG shows normal sinus rhythm and his heart rate is 80 beats per minute. So what is your next step? Obviously, we have here a thyroid dysfunction, most probably due to amiodarone. So what is your next step? Stop amiodarone. Should I stop amiodarone and add levothyroxine to control these symptoms and signs? Decrease amiodarone dose only, add levothyroxine only, no change and follow up after 6 months. What do you think? Yes. Since your patient is now in sinus rhythm and he doesn't have any cardiac symptoms, we should not stop amiodarone. Please don't stop amiodarone in this situation. We just need to add levothyroxine to control his symptoms and to control the thyroid dysfunction. So the correct answer is 4. Add levothyroxine only. So let's discuss it again. Amiodarone is a class 3 antiarrhythmic drug, which means it is potassium channel closing agent. This class of antiarrhythmic drugs control most of the supraventricular arrhythmias like atrial flutter, atrial fibrillation, sometimes atrial tachycardia, and also ventricular arrhythmias like ventricular tachycardia. But what's interesting about amiodarone, 30% of its component is iodine. And we all know that thyroid hormone is composed of iodine too. That's why the iodine in amiodarone irritates thyroid gland, so it may cause thyroid gland destruction. Early, we may have hyperthyroidism due to excessive release of thyroxine followed by hypothyroidism. And in most of the time, we may have hypothyroidism from the start. So the 5 major adverse effects of amiodarone includes thyroid dysfunction, hepatitis, corneal deposits, and skin lesions. For all of these, if your patient now in sinus rhythm and he doesn't have any arrhythmias and he doesn't have any cardiac problem, please do not stop amiodarone unless there is no benefit from it and the patient is still suffering from symptoms. But if it caused pneumonitis or lung fibrosis, please stop it. By the way, pneumonitis and lung fibrosis may happen as early as 1 month after usage of amiodarone. In this situation, regardless the symptoms, the signs of your patient is controlled or not, we should stop amiodarone. Other side effects of amiodarone may include other arrhythmias or bradycardia because it had the ability to lower down the heart rate. So the correct answer here is 4. I wish you loved this clinical scenario. I will see you again in many cases like this. Stay tuned. I wish you the best of luck, my beloved doctors. Bye bye.